We had a triple family bereavement in a short space of time, and bereavement is really so much more serious for an autistic young person to process.
Julia's son Chris had been under the care of Essex Mental Health Services when he died in July 2020 after falling from a bridge in Southend. It's a mother's worst nightmare. Now she wants answers and those responsible held accountable.
On the morning he died, he was supposed to be having therapy. I would pick him up every day. I reasoned that he would be safer there at night because there were night staff. But I'd pick him up every day and he was due to have therapy. I was waiting to drive over and sit outside in the car. I would be 15 minutes early. Take no chances. But the therapy didn't happen and the door was thrown open and he walked out to his death.
Heart House here in Essex is one of a number of mental health rehabilitation services in the county. Now, campaigners are asking for a statutory public inquiry whereby witnesses will have to give evidence under oath into the county's mental health services. And they say this is the only way their families will be able to achieve justice for their loved ones. Leading the petition is Melanie. Her son Matthew was found hanging in his room in 2012. Just a week after being admitted under the Mental Health Act. The inquest recorded an open narrative verdict.
I mean, Matthew was only on the ward 7 days. He had no care plan. He had no key worker. So many failings in his care. Had all the policies that have been written over the years and the processes and the observations and everything that's meant to have been done correctly, my son would still be alive. I hear from families across our nation every single day that are in a situation that I was in 10 years ago, and that has to change. They're desperate for help for their loved ones.
Also within the county, there's an ongoing inquiry looking into the deaths of approximately 1,500 people who died while they were a patient on a mental health ward or within 3 months of discharge between 2000 and 2020. Families concerned say it's limited in scope with no offering of accountability and doesn't go far enough. Meanwhile, Julia wants the system to change so there's more transparency for families when their children are under care.
So there is a barrier between us and doctors. We are not invited to meetings where these issues are being discussed and decisions made. Actually, we are not invited because we will ask for access to life-saving basic health care for our loved ones. And this is not on offer, really.
The fight for justice continues for 93-plus families involved as they push to secure the first ever statutory public inquiry into mental health services. Theo Chikomba, GB News.